What's going on? This is David from Elevated Physical Therapy and Fitness. Today I'm going to go over a concept that I talk to a lot of my patients about, and it's your perception of pain and what good pain is versus what's maybe some warning signs, and then the really bad stuff. We're conditioned to think of pain as danger, right? And some of that is just our innate response to pain because it is unpleasant, and so we immediately try to avoid that type of thing. Some of it is, I think, either cultural or taught to us from healthcare providers, coaches, loved ones, people who maybe mean well, but they give, in my opinion, kind of poor advice. Never do X or your back is going to hurt or whatever, right? That type of limiting belief and limiting advice it can be harmful at times, and so that's kind of something that I go over a lot, because that sometimes the things that we're doing in therapy or when you're training for something, they're uncomfortable and there's some discomfort involved in that. And so knowing the difference between that discomfort that we want to be feeling and we want to work into versus there's danger here or some legitimate tissue damage or something, that's the kind of differentiation I'm going to make. So usually I use a stoplight analogy. I don't have yellow, so I'm going to use pink for that one, but you've got your red light pain, right? And that red light pain is tissue damage, right? You have a severe loss of range of motion, you have severe change in strength, you can't continue the activity that you're doing, okay? So you've got that red light pain down here that is really no good, okay? That's tissue damage. That pain generally does not get much better with time. If you've ruptured something or you have significant damage to tissue, week plus out from that, your pain will be relatively similar. It might calm down some because you generally try to stop moving that limb, or you can't move that limb. So you're like, yeah, it feels a little bit better, but you could not then resume your prior activities even though you've rested on that. That's a pretty clear indicator that medical attention is necessary, and you should be checking in with either myself or your physician or somebody who can triage you appropriately and send you to the person who can help you the best, okay? Your yellow light pain, or in this case pink light because I don't have the yellow, is just your warning sign. You did a little too much too fast, okay? But you're not in the weeds yet. We call it maybe redlining it, where you're right up to the edge of that. But this is where generally my advice is that if your pain is going up greater than 4 to 6 points of pain, and you're starting to get into that 6, 7, 8 range of pain, that's where this is, okay? So your pain increases by 4 to 6 points out of 10, right? So if you're resting at a 2 and you get up to a 6 or up to a 7, that's where this comes in. That pain sometimes is going to be lasting. It's going to last longer than a day or two, depending on how chronic this injury is. Sometimes chronic injuries, it might last a little bit longer, but an acute injury, it should hopefully clear up within 24 hours or so. But it can be that 24 to 72 hours, depending on the chronicity of your issue. It maybe stopped you from doing the activity that you were doing at the time, but after you rested for a second, you could resume it either with a lower weight or in a modified fashion. You would have been able to continue that activity. Whether you did or not is irrelevant, but you have done it. That's where you're resting here. So we'll say, maybe resume modified activity. Okay, so that yellow or pink light pain, that's kind of where you're at. You haven't necessarily caused any damage, so to speak, but it's maybe a warning sign that this was a little bit more than you were quite ready for at the time, but you're gonna be okay. right? This too shall pass, okay? Now we're gonna get into that green light pain, and this is the zone where we wanna live, especially in the rehab world, but also when you're training and things like that, like things get uncomfortable, and that's okay. So this green light pain, this is where we wanna live. We wanna push our limits a little bit. We wanna get stronger. We wanna get through more range of motion. Whatever our goals are, it's gonna be a little bit uncomfortable because the body has to adapt to that change. So the body isn't quite ready for what we're throwing at it yet, but we're doing it at an appropriate dosage where your pain may increase up to 2 or 3 points of pain. So from 1 to 3 points of pain, that's kind of where we want to live here. So that pain's going to increase 1 to 3 points out of 10, right? If you're resting at a 1 and you get to a 2 to 4, perfect. That's where we want, okay? I'll say for either of these, that green or yellow, pink, you don't necessarily want to get to super sharp pain. If it's really sharp and stabbing, that's a clear indicator that maybe we're doing too much too fast right now during the activity. But if you're getting that kind of dull ache or you're getting some other sensations that are mild to moderate, that's okay. This pain doesn't last past the activity. As soon as you stop the activity, it should stop. Sometimes with a more chronic issue, or when you're doing kind of like muscle rebuilding and stuff, it might last for another day or so, but it should be cleared up within 24 hours, and it shouldn't really stop you from doing the activity. You should be able to get through the activity without a major spike in pain, again, within this 1 to 3 range. So we'll say it's, the pain's gone either immediately up to 24 hours, okay, depending on the chronicity. Again, if you're dealing with years-long issues, sometimes that pain sticks around a little bit longer, and it shouldn't really stop you from activity. Okay, this green light pain, that's where we want to live. Okay. Next time you're doing either training, rehab, anything like that, if you're stopping at the very first sign of discomfort, you're not doing it correctly. You're not doing your body justice, because your body is used to that at that point. If you have no fatigue, no discomfort, no nothing, you're not doing enough. Okay. Therapy and training should not always be very comfortable. They shouldn't be super painful, and that's what this model, this analogy, I'm trying to kind of bring to light with that. So just focus on your body, learn from your body, and adapt your training or your rehab as necessary. And if you're having trouble doing that, reach out, talk to me. I'll answer any questions, and if we need to get a little more detailed, then we can talk about that.